You may think osteoarthritis affects only older generations, but even people in their 40s and 50s are affected. A new survey finds many women with significant hip or knee pain are essentially living through their lives on pause and giving up activities they enjoy to avoid triggering the pain. Here now with more information about joint pain are orthopedic surgeon Dr. David Fisher and his patient Lani. Doctor, why do so many women put their lives on pause when dealing with pain?
Well, the pain from arthritis is a gradual onset of symptoms that can affect the knee to the hip, anywhere in those areas. But it gradually starts as a mild discomfort that progresses to more significant symptoms of pain and ultimately loss of function, whether it's getting up from a chair, going up and down steps, or walking across the floor. Patients will gradually give up activities and it affects their quality of life significantly. And when that happens, then ultimately they will seek treatment. The survey that you're referring to was sponsored by Depew Synthes, for whom we're here today. Basically, that survey involved patients or women between the ages of 45 and 65 years of age who had either undergone total joint replacement or were about to. And this included over 500 women who reported that they had put up with their symptoms for up to 5 years and had basically just tried to ignore them until it just got to the point where they had to do something because their quality of life was so severely impacted.
Doctor, when someone is experiencing hip and knee pain that is associated with osteoarthritis, when is it time to see a doctor?
Osteoarthritis is the most common form of arthritis, and it affects about 30 million Americans today. That number is projected to double over the next 15 years. And as the symptoms as I said, it's a gradual onset of aching and pain. They should probably see their primary care physician at some point to see what is going on, get an x-ray. Treatments may range from medical treatments to physical therapy to an intra-articular injection, and ultimately, as the joint continues to deteriorate, be seen by a specialist in orthopedic surgery, and a joint replacement may be indicated.
Thank you. Lani, could you share what it was like living with the pain and why did you decide to have joint replacement surgery?
The pain gradually became, just as Dr. Fisher says, so debilitating that I was unable to perform my daily functions at work, daily home functions. I like to garden. Most importantly, it was really limiting the ability to work with my horses. Spent a lot of time trying just to manage it. Ended up going to my primary physician and ultimately ended going to the orthopedic specialist where we discussed all of the options. And for me, the total knee replacements were absolutely the right decision. I got my life back, able to work, able to garden, and most importantly, able to ride my horses.
Thank you. Doctor, in your experience, is Lani's experience similar to those found both in the survey as well as the patients you see in your practice?
Absolutely. I see this every day where people would put off having something done until they just can't go on. In many cases, their health condition deteriorates in that period of time. So earlier treatment or early treatment to try to manage the symptoms is indicated to keep them active, and joint replacement will certainly improve their quality of life. In the survey reported, 4 out of 5 women who had the surgery wished they had done it before.
Thank you. Lani, what advice do you have for women who find themselves dealing with knee or hip pain?
I recommend that you go to your primary physician, talk to them. Don't wait until it gets so debilitating that you can't continue to live. And so talk to your primary physician, see what's happening. You can also go to our website, timetohitplay.com. A lot of good information on osteoarthritis and what your other options can be. For me, the joint replacement was the right thing to do because, like I said, it got me back on track. I wish I had done it sooner.
Thank you. Doctor, is there anything you'd like to add about osteoarthritis?
No, I agree completely with what Lani said, and certainly seeking treatment from your primary care physician and ultimately consultation with an orthopedic surgeon is what you would probably need.
I'd like to thank you both for taking the time to talk with us today.
Thank
Have
you.
a great
Thank you
day.
so much.
Thank you.
Bye.